Good afternoon. I'd like to welcome everybody to this pep talk this afternoon. Please mute yourself, but always show your video picture. Sign in your name, your Facebook account, or email address in the chat box. Please include the names of companions attending with you. Use the chat box to ask questions and make comments while the pep talk is on. There will be group pictures at the start and end of the pep talk, so please show your faces in the video. A reminder is that after the pep talk, please take the online learning comb evaluation test exercise for mastery of learning and have a perfect score to get a certificate like this one shown here. I have placed the link in the chat box. Another reminder, obtaining 50 OLETE certificates will entitle one mentee to a voucher for a ROJoson telemedical consultation like this. Another request, please type in your feedback in the chat box during the open forum and before we adjourn. Let's now have a group picture taking before we start the pep talk proper in 2 minutes. Get set. 1, 2, 3. I have a patient empowerment program in which I like to empower the lay people or patients to take control in the management of their health. I started the pep talk on May 15, 2021. There are 3 courses in the pep talk. I completed the core course on October 9, 2021. And from October 23, 2021 onwards, I've been tackling health disorder and health issue courses. This may take 3 years or longer, depending on our enthusiasm, discipline, and perseverance. My pep talk today is entitled, How to Live a Life with a Possible and Actual Cancer. The empowerment objective is for the lay people to have an essential understanding on how to live a life with a possible and actual cancer in their health management. The contents of this particular pep talk will it will contain my thoughts, perceptions, opinions, and recommendations on the topic. Okay. So these recommendations or TPOR are culled from experiences of other professionals as well as from my personal experience. As an intro, in our life on Earth, any kind of disease, including cancer, is always a possibility, and there is no sure-shot way of prevention. This is because all the diseases, including cancers, are often caused by an interplay of a lot and combination of risk factors or causes that no one can really identify the exact cause. It's hard to say that there is only one cause. It's usually an interplay of multiple factors. So with the exact cause difficult to identify, there is no sure way of prevention. Now that's why, as I said, any kind of disease, including cancer, is always a possibility. Now, focusing on cancer for today, any person can develop a cancer anytime, in any part of the body, in spite of efforts to prevent or mitigate the modifiable risk factors. When you say modifiable risk factors, those that you have controlled on, such as environmental and lifestyle factors, particularly on the diet and exercise. One just have to accept this reality and live on. The best stance would be just hope and pray that you will not develop a cancer. The stance of everybody should be acceptance of the reality, but with continuance of avoidance, continue to avoid all known modifiable risk factors for all types of cancer. So the non-modifiable risk factors will be the age and the sex, in which sometimes these are the risk factors for cancer formation. So non-avoidance of all known risk factors carries a higher chance for developing a cancer. Whereas when you try to avoid all the known modifiable risk factors like smoking, drinking alcohol, okay, this carries a lower chance of developing a cancer. Lower, okay, not an absolute, not zero, but it will mitigate and make the chances of developing a cancer lower. So after acceptance of the reality that cancer is always a possibility and avoidance of all known modifiable risk factors for all types of cancers, the next thing to do is to learn the alert signs of cancer, so that if a cancer unfortunately develops, as I said, we can never predict, it will be diagnosed early through self-monitoring, specifically through listening, feeling, palpating, and examining one's body. Self-monitoring. The alert or warning signals of cancer consist of the following: change in the bowel or bladder habits. So this might be the alert symptoms of colon cancer, rectal cancer, or urinary bladder cancer, Okay. A sore that does not heal. It could be a skin cancer or a soft tissue cancer, or in any parts of the body, it could be a cancer. A wound that does not heal after a certain duration in which you expect it to heal. Let's say after 2 weeks, you expect it to heal, but it doesn't heal after 2 weeks. Then you may have to suspect something bad is going on. Unusual bleeding or discharge anywhere. Unusual bleeding in the alimentary canal, like the stomach, from the rectum. So this might be an alert sign for cancer. Discharges like vaginal discharge can also be an alert sign for cancer. Thickening or lump in the breast or elsewhere. The moment you have a lump anywhere in the body, we always speak of the possibility of cancer. Okay. It's mentioned here the breast because breast cancer is very common in the Philippines as well as in the world. That's why it's included in the list of the alert and warning symptoms. Indigestion or difficulty in swallowing. So this could be alert symptoms of esophageal cancer, okay, stomach cancer, okay, and then obvious change in the wart or mole. Okay. So this could be a melanoma, okay, a cancer arising from the mole, okay. Then nagging cough or hoarseness. So this could be an alert sign of laryngeal cancer or lung cancer, okay, or cancer of the throat. Okay. So these are the more common alerts, warning symptoms of cancer that we have to remember and to watch out for. Of course, there are other warning symptoms, but above are the more common ones. Knowing the alert symptoms of cancer should be accompanied by a must-do self-examination of one's body. So examining one's body, which should be done regularly and continuously. My recommendation is at least a month. You can do it every day if you're doing something that will involve touching your body, just like washing your hands or taking a bath. Do it, but every month, at least do it systematically. Okay, and then so these are the areas that the minimum area that you have to do self-examination: skin and soft tissues self-exam, mouth exam, neck exam. This will include the thyroid, breast self-exam, and abdomen self-exam. So these are the minimum. Okay. Self-examination consists of regularly looking and palpating the body parts that can be seen and touched by oneself for anything that is unusual. So you look and palpate for anything unusual. So you don't have to be a doctor, you don't have to memorize all the diseases, but that the basic things that you have to do is to look for anything unusual. So that's the starting point of suspecting something might be wrong. So if anything unusual is discovered, it should be brought to the attention of a cancer specialist as soon as possible. Personally, I don't recommend routine screening diagnostic tests for cancer. I prefer a screening approach that consists of the following. So monthly self-examination, as I said, the 5 main areas: skin, the neck, the mouth, the breast, and then the abdomen. And then the other part of the screening approach that I would recommend is that after you do the self-examination on a monthly basis, as much as possible, have a cancer specialist clinical examination, not the laboratory test, just a physical examination. Just like when you go, when you have a, I think last time we discussed about dental health. Okay, so you have to take care of your own teeth, but much better if you also have a dentist checkup every now and then, let's say yearly or every 6 months. Okay. So the third approach in the screening for cancers in general will be selective. I go for selective, not routine. You don't have to do every yearly this and that examination. So selective means that you do it for those who have a high risk for a particular cancer, then that's time you do a particular test. So all the above can promote early detection of cancers, and it will be cost effective at that. So you don't have to spend too much, so much for the, especially the screening diagnostic test. There are many cancer specialists in the community. One just has to choose who is a cancer specialist or the type of possible cancer that one may have, such as choosing a cancer specialist for a possible breast cancer, a head and neck cancer specialist for a possible head and neck cancer, an abdomen cancer specialist for a possible abdomen cancer. So try to look for specialists on this area where you suspect that there is a cancer growing or developing. So aside from choosing a cancer specialist on the type of possible cancer that one may have, one has to choose a specialist who has a track record, who is known for being competent, trusted, and compassionate. Competent, trusted, and compassionate. If a cancer is diagnosed, one should be treated as early as possible by the chosen cancer specialist. Early diagnosis and early treatment is the recommended complementary set of actions that should be done by anybody with cancer diagnosis, as this set will contribute to better treatment outcomes, particularly in terms of lesser complicated treatment and complications and better survival rates. So we frown upon you do an early diagnosis, but you don't end up with an early treatment. So you're complacent and then just keep on delaying. So you end up with a late treatment. So we frown upon this. Okay. So we don't like late diagnosis and late treatment. During and after treatment of a cancer, the following are the recommended strategies on how to cope with the psychological and mental stresses associated with cancer diagnosis. As we all know, after a diagnosis is made, the balls start rolling on the anxiety, anxiety and depression and psychological mental distresses. Okay, so how do you cope up with this? Number one is acceptance of the cancer. It's there already, it's diagnosed. Then trust in a competent and compassionate physician. Spiritual trust is also a must. support from loved ones and significant others, cancer journey sharing as much as possible, and then intentional living plan in the light of cancer. Acceptance. After the establishment of the definitive diagnosis of cancer by a trusted physician, acknowledge it as soon as possible. Accept it that there is already a diagnosis of cancer. So it is better and psychologically, when I say psychologically, emotionally, and mentally, okay, to face head on the cancer, the cancer, than try to deny it. After acceptance, concentrate on planning and deciding with a trusted and compassionate physician, number one, the realistic goals of treatment, whether to aim for complete remission or just palliation, because there are instances in which your cancer was detected in the late stage or you didn't have it treated right away. Okay. So the goal will just be palliation. We just have to accept that. But if you catch it early, then you have a greater chance for a treatment whose goal will be complete remission. Number two, okay, deciding with the trusted, compassionate physician on the most cost-effective, including affordability of the medical management based on the goals, whether it's complete remissions or just palliation. So you just have to choose the most cost-effective treatment, and then decide on the coping tactics that will be harnessed for any psychological distresses that have been identified. So you have to get the support of your trusted and compassionate physician on this. Trust in a competent and compassionate physician. So even before the cancer strikes, I would suggest that you identify already a trusted physician to seek right away for consult and medical management. So because we don't know when a cancer will strike, so just be ready on hand to identify people whom you can go to, you trust them, that you can go to whenever there is a crisis occurring. So identify a competent and compassionate cancer specialist, put it in your list. Competent not only in expertise in the medical management of the cancer, but one who also provides psychological and psychosocial therapy and support simultaneously with the medical management. This is very important to emphasize because this one is not frequently being done by the cancer specialists. They just focus on the medical management. Compassionate, not only in expressing sympathy, not only saying, I'm sorry that you have this cancer, but one who also exert tangible efforts in providing psychosocial therapy and support, inclusive of easing the financial burdens of the cancer patients and the relatives. Nowadays, it's important to consider the expenses, the monetary expenses. So you should have a physician who will be compassionate enough to include the consideration of the financial burdens, aside from the medical treatment. Spiritual trust. The concept of the word spiritual, as will be used here, is that it is not exclusively equated to religious or identified to a particular religion or referring to the presence of God, a creator, or higher power. Spiritual will be operationally defined here as one relating to deep feeling, thoughts, beliefs affecting the human spirit rather than to the human bodies, material things, and physical surroundings. So it is something beyond the physical world when you talk about spiritual. In the Philippines, oftentimes spiritual is used to refer to something religious, to a religion, to a presence of a God or creator. But whatever spirituality a cancer patient has, he or she can seek or rely on it to use a coping tactic for the psychological distresses that he or she is having. But a caveat, the reminder is still to factor in the usefulness and limitations of medical science when using spirituality as a coping technique. Okay? So don't just say, okay, na spiritual trust, no more medical treatment, no more considerations of the medical treatment. Support from loved ones and significant others. So the general advice is do not do it alone. Do not face the crisis alone. Get the support of loved ones. Seek the support from loved ones and significant others to cope with the fear, sadness, personal apprehensions, and particularly the psychosocial apprehensions. So these are the four main types of psychological distresses that we see in cancer patients: fear, sadness, personal apprehensions, and psychosocial apprehensions. So seeking the support of loved ones and significant others can provide great assistance in coping with the psychological distresses in case a cancer specialist is not providing it and cannot provide psychosocial support. So you really have to rely on your loved ones and significant others if the cancer specialist is not doing it. But as much as possible, look for a cancer specialist who can also provide psychosocial support. A caveat is for the loved ones and significant others to fully support whatever sensible decision is made by the cancer patients on the management of their cancers. Okay. So let the patient decide as much as possible for herself, as long as he's doing it properly. And then, if you sense that he's not doing properly, you can try to convince her or educate her. Then, but whatever decisions that will come out in the end, all the relatives should support it. Cancer journey sharing is encouraged and it shows acceptance. The moment one does cancer sharing, nakikita natin may acceptance na yan. As I said, acceptance is the most cost-effective. This is most effective coping strategy or tactic for the psychological distresses of cancer patients. Cancer journey sharing or sharing cancer stories is a meaningful and effective way to raise awareness, malalaman tungkol sa cancer, its treatment, prognosis, psychological distresses, the different types, as well as to provide psychological and psychosocial support therapy not only to others, the one hearing the cancer story, but also to the one who is doing the sharing, himself or herself. The last one is on the coping strategy would be to do an intentional living plan in the light of cancer. I want to emphasize in the light of cancer because the setting here is that you have a diagnosis of cancer already, so you have to come out with an intentional living plan adjusting to the situation in the light of cancer. Living a life of cancer with cancer is a journey into a world of cancer. Isang mundo yan cancer. The cancer world is full of uncertainties. Sad to say, but we just have to accept it. There are a lot of uncertainties, such as unknown specific causes. Sinabi ko na kanina, maraming hindi pa nating alam ang real cause. It's hard to identify. Always with the possibility of recurrence after treatment, and not knowing the mode and time of exit. How you're going to have recurrence, how you're going to die, how you're going to end, how your life on earth will end. So just to name a few of these uncertainties. The journey or voyage is very, very rough with unquantifiable. You cannot measure the physical pains and psychological distresses. Everybody with a cancer must formulate an intentional living plan in the light of a cancer diagnosis and take note of all these realities of a life with a cancer. Although cancer is not always a death sentence, especially those who consulted early, diagnosed early, and treated early and correctly, recurrence is always a possibility. No doctors will guarantee that there will be no recurrence, no doctor. Okay? For those with advanced cancer disease and recurrence, they will have limited lifespan left. So we just have to accept that because it's already advanced and there's all recurrence. Okay. So whatever groups of patients with early or advanced cancers, they must continue to live on kahit na papano, kahit na advanced na, kasi we don't know what will happen also. Okay, nobody can predict. So we just have to continue to live on. So with a well-formulated intentional living plan in the light of cancer, all cancer patients must continue to do the following with the support of a compassionate cancer specialist, then spiritual advisor as much as possible, and loved ones and significant others, okay, so that you will be productive, will have a peace of mind, be contented, enjoy life, be happy. You'll be able to reach the realistic longevity targets, and then be ready to face curtain calls or death in case that's the situation. So phase of intentional living plan in the light of cancer. Again, for those who are near the end of life, we know that a lot of times because of the recurrence, we have reached a phase in which there's an end of life in the person's cancer. Okay, the intentional living plan should include the following: try one's best to stay alive and productive up to the last moment. As I said, live on until to the last. Okay? Kahit na advance na. Make peace with God or Creator or higher force. Make peace with everybody. Endorse material possessions. Kahit na paano, meron kayo. Kahit na, some would say, ay, wala naman kaming kayamanan. But somehow, you have material possessions in your house. Make clutter management of earthly possessions. Make an advance directive about healthcare and funeral arrangement para hindi mahirapan yung mga kamag-anak na iiwanan. Of course, bonding with the family, okay, as much as possible before you don't see each other anymore. Then lastly, enjoying oneself to the fullest up to the last moment. So the overall advice is to have acceptance of the cancer as the first step in living a life with a possible and actual cancer, so as to live a functional and meaningful earthly life as long as possible. So this is my general statement, overall advice, takeaway. But more specifically, make peace with cancer disease or cancer diagnosis, meaning acceptance. Let go, but not totally giving up. Continue to live a functional and meaningful earthly life as long as possible through your well-formulated intentional living plan. So importante yung intentional living plan. So takeaway in relation to patient empowerment, be always in touch with reliable medical information on how to live a life with a possible and actual cancer. Knowledge is power, it gives power. Use the 4 Ks of patient empowerment: kaalaman, kakayanan, karapatan, and kapangyarihan to gain greater control over decisions and make better decisions on how to live a life with a possible and actual cancer in your health management. So this ends my pep talk this afternoon. I hope I have empowered you to have a better understanding or the essential understanding on how to live a life with a possible and actual cancer in your health management. And before we go to the QA, question and answer portion, reminder, please take the online learning curve evaluation test exercise for Master at Learning to get a certificate like this. And then 50 OLETE certificates will entitle one to mentee to a voucher for a ROJoson telemedical consultations. And type in your feedback in the chat box during the open forum and before we adjourn. So let's now have a group picture taking again, second one, before we start the question and answer and interactions. Okay. One. Pahabol. Christy. Okay. 1, 2, see. Okay. So the floor is now open for questions on the presentation, comments, and sharing of experience. Anybody who wants to start? Anybody wants to share? So we have Ellen, Phoebe, Lorlier, and Melly. Okay. I think they are now. Do you agree with what I said? Acceptance is the most effective way of coping.
Yes.
Melly?
Yes, doctor,
Yes.
acceptance, so you can live on with your life.
Okay. Ellen?
Yes, Doc, very true.
Acceptance na lang.
Acceptance.
Okay. So, but after acceptance doesn't mean that suko na, di ba? So you really have to solve the problem, no? Okay. So try to see what can still be done, no? And then try to listen to the advice of a trusted doctor, a physician, no? And then come out with a decision together with the physician, no? Okay. Okay. Then, did I miss anything on the strategies? Do you want to add some more? Spiritual trust, support of the significant others. Do you have any comment on the significant others? Are there a lot of patients who would I think majority are really relying on the support of the significant others, but are there patients who want to keep the cancer to themselves? Meron din, di ba? May naririnig kayo?
Oo, meron.
Yes.
Sinong magre-react?
Meron, doc. Yung iba, ayaw kasi mag-worry yung mga family, so they just keep it to themselves.
Yung iba ayaw
Mag-worry yung family,
okay.
so they just keep it to themselves.
Okay.
And then minsan nag-wait na lang sila na last stage na, and then tsaka na lang nila sasabihin. Para hindi na rin mentally burden yung mga relatives, mga ganun.
Okay.
Physically, financially. Ganun.
Okay. So that's one reason. Any other reason why they keep it to themselves?
Maybe because of fear.
Fear of
Um,
denial?
Yeah, denial that they have cancer. Still, they cannot accept that they have that kind of disease, So
Uh,
I think it's more of fear.
Fear. Okay. Okay. Yung iba naman, baka may apprehensions, yung tinatawag, I call it psychosocial apprehensions. Ayaw nilang malaman ng iba, mga kaibigan nila. No? Parang very secretive sila. They just want to keep it to themselves. Di ba? May mga ganon. Okay. So,
Maybe it also constitute about fear because minsan kasi pag nalaman nilang may ganyan sakit, ang pumapasok sa isip nila yung rejection,
kaya nga, I call it psychosocial apprehension, involve yung ibang tao, di ba? Kaya ibang tao na-affected sila by the other people's perceptions, di ba? Okay. Pero overall, mas maganda pa rin to be open and then tell it to the relatives, di ba? Okay. Pero meron talagang tinatago lang talagang ayaw pa alam sa iba. Na, okay.
And
Yes.
most of them they share it with their friends.
So, okay yun. Kung they share with their friends, di okay. At least may kausap sila. Parang significant others na rin yun.
Yeah, the significant others.
So, okay na yun kung ano. But may mga pasyente talaga, they really want to keep it secretive talaga. No? Talaga ayaw nila paalam. No? And then even the gamutan, pupunta sa silang lugar na hidden, ayaw nila paalam sa ibang tao. Diba? May mga ganon din. No? Okay. I suppose meron din tayo mga examples ng mga well-known figures in the society na magpapagamot sa ibang bansa. Di ba? Ayaw nila paalam. Di ba? Ganon. Ganun din yon dito. Yung mga hindi naman well-known figures, tinatago nila. They try to have the treatment done somewhere else and then parang di malaman ng iba. No? Okay. So for what reason? Marami parang ayaw nila magkaroon ng may magpipiti sa kanila. Sometimes they don't like to see people pitying on them, no? Okay. Sometimes talagang ayaw nila yung sabi nila. Nahihiya sila. Kung minsan nahihiya sila, ayaw nilang paalam. No? Okay. Okay. So I guess the best is still to let it known to everybody, to anybody, or to significant others at least, di ba? Loved ones, no? Kung ayaw yung move.
Or joint support group. That is very helpful. Joining a support group.
Kaya nga, hindi, kaya pag pinag-usapan natin, ay tinatago nga nila di ba?
Yeah.
Oh. So kung open na sila, I think they'll be open to join the support group already, di ba? So when they join the support group, madali nang mag-share na sila ng cancer journey sharing, di ba? Even in those with support group, minsan okay, they get the benefit of the nakikinig lang sila, they see the other patients, pero themselves sa kanila, sarili nila, ayaw nila mag-share pa rin, di ba? May reservation pa rin sila, no? Okay. Okay. So, any more comments? Spiritual trust. I wonder yung mga 80s. wala pa ako na-encounter na, should I say 80s. Kadalasan nakikita ko lahat may spiritual element. No? Meron kayo na-encounter na na may atheist na hindi naniniwala sa Diyos na
Parang naka-encounter ako ng ganyan. Not really atheist. Before kasi napaka-faithful niya prayerful. And then it happened na nagkaroon siya ng cancer. And then after that, so she's praying a lot. Sabi niya, ganito, ganyan. Helping other people, helping friends. And then dumating yung time na nagkaroon naman ng cancer yung husband niya. So parang after that, medyo hindi na naging maganda yung faith niya Kasi parang ang sinasabi niya kasi noon nung nag-share siya is, I've been so faithful, I've been so prayerful, I help a lot of people, friends, and then namatay yung husband niya before her. So parang nawalan siya ng isang kamay. So yun, parang nawalan na siya ng trust, parang hindi na siya naniniwala. So nung nakikinig kami sa kanya, na sinasabi namin sa kanya na still God, when you pray, when you trust, maybe that's one indication na the Lord is still trying to test you how faith you are, how prayerful you are. Pero nawala na yung faith na yun sa kanya And then, wala na, hindi na siya nagdadasal. And then, we just found out na matay na rin siya.
So, hindi mo alam kung in the end, last minute, kung bumalik siya.
Parang hindi, Doctor. Kasi talagang bitter siya Parang bitter. Everybody among the group kino-convince siya na ganito, ganito. So, sinasabi niya lahat yung mga nangyari, yung mga ginawa niya. But still, sabi niya, bakit kinuha pa rin yung husband niya, tapos siya may cancer din, yung ganun. So, nung nagkita-kita kami noon ng summer outing noon, medyo hindi na maganda yung kanyang faith and trust in the Lord.
Yeah.
But we all tried to convince her na syempre parang bitter lang siya kasi nga nangyari yung ganon. Pero with other people like her na sinasabi niya, I've been helping a lot of people, a lot of friends, my family, and then yun, parang yun daw ang naging pa.
Okay. So parang ano yan parang nag-turn around siya, no? Nawala siya
Yes.
trust.
Yes, nag-turn around siya.
Turn around, parang na-frustrate siya.
Mm-mm.
Of course, we heard stories that after a while, yung iba bumabalik, di ba? Parang part of
Yes.
human weakness yan di ba? So mawawala
Mm-mm.
yung trust sa Lord, sa God, no? And then after ma-counsel siya ng ibang tao, iba bumabalik, di ba? Bumabalik.
Mm-mm. Yung yung last summer outing, yung mga nakausap ko noon,
Mm.
parang ganon. Kasi nung sinabi ko yung about the intentional living,
Mm.
na pinagawan ko sila, and then yung mga people na parang malapit sa puso nila, then they became enemies. Ando din yung forgiveness na inilagay nila din sa letter nila na pinatatawad din nila yung mga, mostly kasi relatives Para
Mm.
kasing nung wala pa daw silang sakit, sila ang tumutulong. And then nung nagkasakit sila, wala nang tumulong. Parang they were deprived. I think 5 of them, ganon. Pero nung pinagawan ko sila na intentional living, doon sa pinakahuli, what is the most I think kung ano yung pwede mong gawin at the end of your life na pwede mong ibigay sa mga nakakaway mo or sinabi nila yung forgiveness, and they really put their names, yung mga taong pina-forgive nila for the things that they have done to them.
Yeah.
And of course, the Lord, yung si Lord, yung hindi sila pinabayaan, parang nagtanong sila bakit. It's usually why why me, why them, and then at the end parang ganon, humingi rin sila na parang note of forgiveness to the Lord na naging manipis yung kanilang faith and trust in Him.
Mm-hmm. Yeah. So importante yung may peace of mind before you go, no? Dapat let go lahat, no? Bago ka.
Yes. Kasi yung time na yon, parang they heard about the intentional living, but they were not explained of what is the intention of the intentional living. So kaya parang it opens their mind na yun nga yung bago sila mawala, malakas pa sila na ganon. How many times should I forgive my brothers and sisters for the sins that they have done against me? Parang yun ang na-realize nila during those time. And I was so happy na yung ma-meet yung mga ganun tao na in spite of everything, they were able to give their forgiveness through that intentional living that I told them to do. Very short pero very meaningful yung nangyari ng time na yun.
Yeah, okay. So I hope they can implement it, and then kung di sila ma-implement to the letter, at least balikan ng balikan, then improve and improve. No? Ganun lang naman ang tao no? May
Yes.
nagfo-falter, then balik lang. No? Okay.
And the significant others really helps a lot. Most especially if you are a member of a support group na they just wanted to be heard. They just wanted na may magsabi sa kanila what they feel, yung mag-break nung bigat sa dibdib nila. So, maganda yung ganon.
Yeah.
Kaya nga sabi ko, dapat magkaroon ng parang yung everyday na yung call a friend, di ba? Yung call a friend na para pag ganun time na medyo down sila, you are there to comfort them, to pray with them. And
Parang,
that's very
yeah.
good.
That's also the strategy ng mga sa mental health. Pag may depression, no, they come out with a telephone number. Just call us. Just call us, di ba? Talk to us, no, ganon. Okay. So very challenging talaga, no? Okay. Okay. Any other comment? Rex, would you like to share your experience with your mom several years ago? Ganun din mami mo, 3 years na ba yun? 4 years ago.
Yes po, Doc. Yung kay ma'am po
Acceptance.
Opo. Kasi po nung tinanong po ako nung nanay ko kung gagaling pa siya, hindi ko rin po kasi siya nasagot ng diretso. Which is,
Mahirap sagutin. Mahirap sagutin diretso.
Opo. Sabi ko na lang po, ginagawa naman natin lahat at nananalangin din naman po tayo. Ayun po, tumahimik naman po siya. Kumbaga nakinig naman po siya. Tapos, very talaga po, Doc, yung nakita ko po doon ay yung tinatawag nyo na psychosocial yung factor na yon based on my po, parang na-realize ko, ako personally ayaw din kasing mapaalam ni nanay na may sakit siya dahil nahihiya siya. Tapos, pero sa akin niya lang po muna pinaalam yon yung nagkaroon siyang bukol. Ako lang po kasi yung nandito nun. Tapos, ayun po, 2012 po yun na doon pa lang namin nakita doon niya pa lang una pinakita na may bukol nga po siya. Yun, along the journey po nung kanyang cancer journey niya. Ang mahirap po kasi, Doc, yung sa last stage na. Pero medyo mas na-lessen kasi nung time na nakakausap nga po namin kayo, nagkaroon kami ng idea kung paano namin i-accept. Unlike nung dati na nangangapa po kami kung paano namin paghahandaan. Alam naman din po namin na medyo parating na siya sa curtain calls. So, po, malaki yung sa mga minsan kasi ang problema, minsan napo-focus tayo dun sa patient, pero minsan nakakalimutan natin na yung nag-aalaga pala yun pala yung affected na rin din talaga psychologically, yung ganun. So naranasan ko po talaga yun. Yung mga kapatid ko siguro hindi ganun ka impact kasi nasa abroad sila kaya ako po kasi yung mismong nag-release ng sugat na yun, maasikaso, check up dun, check up dyan. So parang feeling ko kailangan ko ng debriefing.
Debriefing.
Apo, kailangan kong ma-debrief. So kaya po nakakatulong sa akin kapag nakakapag-communicate po ako sa inyo kung ano yung mga dapat gawin as caregiver. Ngayon po nare-realize ko sa akin, sa sarili ko, parang ayokong magsabing halimbawa kung may sakit man ako or may nararamdaman ako sa sarili kong parang may unusual ako nararamdaman. Para kasi natatakot ako na parang feeling ko ma-judge ako ng tao.
Ma-judge ng tao.
Okay. Baka po i-judge ako ng tao. Parang feeling ko, isipin nila, nagkasakit yan kasi baka hindi healthy kumain, hindi maayos yung lifestyle, mga ganon. At saka parang, yun nga po, kung ano nang minsan pumapasok sa isip ko. Kaya minsan, yun yung naghihinder sa akin na magsabi kung meron akong parang unusual na nararamdaman. Yun po. So, pero the best pa rin po talaga na, yun nga, acceptance. Eventually talagang, as much as possible, matutunan natin kung paano natin ma-accept kung sakaling nandun po tayo sa pagkakataon na yun na meron po tayong cancer.
Okay.
So support group po, malaking bagay po. Katulad po nito, I consider this group as support group na rin po.
Okay. Oh, sige.
Yun lamang po. Salamat po.
Thank you for sharing. Pero going back, although I'm a doctor, I don't claim to be a talagang expert in everything, in every aspect. Kung ako man, kung let's say nagkaroon ako ng isang sakit, no? Let's say today, may na-discover ako ng something, example lang ha. Siyempre, number one, mag-worry ka sa sarili mo. Ano kaya yon? Ano kaya yon? Di ba? Number two, mag-worry ka. Ang pag-iisipin mo kung ano, do I tell somebody, di ba? Do I tell my wife, ano, di ba? So kung minsan ayaw nating i-burden din sila, no? Mag-worry sila, di ba? So tendency is not to tell them also. Okay? Yung iba naman, may mga tao naman talagang sinasabi, no? Sa mga kamag-anak, no? Pero it all depends on the person. Probably I'm the type na probably ayaw ko mag-worry yung asawa ko, ganun muna, i-analyze ko muna, i-diagnose ko muna, ganun, no? And of course, the other thing that probably that can, my apprehension is also baka I don't like to announce it to to my friends muna, no? Okay. I don't think, anong reasons bakit ayaw ko i-announce sa ibang friends? Number one could be, what? Nahihiya ka in the sense that pwede yun. Kasi may mga doktor gano'n eh. Ayaw nila malaman may sakit sila kasi sabi na, doktor ka. Kasi perception ng mga lay people, doktor ka na eh, nagkakasakit ka pa. Di ba? So gano'n, ayaw mo pa alam sa iba because sa ibang tao, nahihiya ka, lalo na probably yung mga sakit na nakakahiya na pag cancer o ano baka sabihin na, hindi mo, parang pinabayaan mo sarili mo kasi baka sabihin ng ibang tao, di ba? Ganun. So the other, mga possible reasons na ayaw mo pa, yung sinabi mo, they will look down upon you. It's
Opo, parang-
yeah, they will look down upon you, gano'n. Yeah, that could
Okay.
be, no? That could be, no? Yung iba naman ayaw pa alam para because they want to be seen as malakas pa, walang sakit, di ba? Parang denial, di ba? Okay. They don't like to they also don't like to be affected to be yung trabaho nila, di ba? Kasi
Status symbol.
pag nalaman ng ibang tao, baka sabihin, ay, huwag ka na magtrabaho, huwag ka na, ganon, di ba? Okay. So yun, I guess all of us will go through that stage also once we discovered something. Na, okay, kung sasabihin o hindi, and then. But in the end, what? In the end, the person will have to make a decision when it will be the right time. No? But there should come a time that dapat mag-decide siya. Okay, to tell it or not. Okay.
Can I add to that?
Yeah.
Do you still remember nung siguro 5 years or 7 years pa lang natin na ilo-launch yung Cancer Crusaders Club? And then Secretary Ordonez is in the position. He has a government position din, di ba? Tapos uma-attend siya. So pag tumatawag ako na mag-share sa stage, hindi ko sinasabi na ikaw ang mag-share, ikaw yung kasi nga lagi sasabihin ayoko, di ba? Do you remember nung tinawag ko si Secretary Ordonez sa stage na mag-share about her wife? Parang naging opening sa kanya na bakit ko nga ba tatago na merong cancer yung wife ko? Diba? And still at that time, I still remember that na parang uma-attend sila ng gathering natin every year, pero hindi pa rin nila mag-grasp sa kanilang sarili that Ma'am Sylvia has a cancer.
Mhm.
Diba? So, right then and there, nung tinawag ko siya sa stage, doon lang niya natanggap at nasabi na merong cancer si Ma'am Sylvia. And look at her now. Ma'am Sylvia is, I think, 34 years
Yeah.
survivor, di ba?
Yeah.
Yun yung ano. Sometimes you really have to um, open their mind. Madaling sabihin sa isang significant others na katulad natin. Pero once na na-open up yung kanilang mind and heart, that this is the best that you can do to accept things na nangyari sa'yo. Diba? That's divine. Look at her now. Buhay pa rin si Ma'am Sylvia.
Yeah.
Oh,
Yeah, pero kaya nga nobody will argue that di pinaka-importante acceptance,
mm,
no? Pero kasi because of
yes.
human weakness, no? So probably one is could be the timing, yung iba naman yung there'll be a change in personality or basta baka may magti-trigger na magbago siya, no? Magbago ang outlook niya, no? So we have seen a lot of patients
Course.
also initially secretive sila, ayaw na magsalita, yung iba after 1 or 2 years. Okay. I won't mention the name, meron tayong mga kasama dito sa grupo na ganon. First year ayaw niyo paalam, second year yun na, okay na, pwede na, di ba? So ready na sila, no? So we just have to wait, no? Ganon. Okay. So anybody else who want to share?
Doc, siguro po ano lang, additional lang.
Oo.
Na-realize ko po kasi dati nagpa-check up kami ni nanay doon kay Dr. Enriquez, yung mag-asawang Enriquez. May TV program yan eh, Healthy Living or Healthy Life. So ang mindset ko, pagpunta ko doon, makikita ko yung lalaking doktor. Ang nakita ko na lang yung babae.
Mhm.
Kaya ganun ang mindset ko kasi iniisip ko buhay pa yung silang dalawa. Tapos tinanong ko, asa na yung lalaki ngayon, si Dr. Enriquez? Sabi, patay na. Tapos parang ang naging ano sa akin, naisip ko, parang medyo, ba't patay na eh? Sila ngayon nag-advocate, nagtuturo nga sila ng longevity eh. Parang parang nagulat lang ako. Parang na-expect ko, alam ko, sana buhay pa to. Parang inisip ko, buhay pa dapat sila. Yun yung mindset ko. So, kaya ko sinasabi kasi parang yung dinidiscuss nyo nga po, no one can tell talaga cancer talagang kahit katulad no ni Dr. Enriquez, parang napaka-healthy living niya talaga kasi yun talaga yung lifestyle niya, profession niya, may TV program pa. Tapos parang tingin ko hindi pa naman siya ganun ka-old. Tapos patay na. Parang hindi na lang ako nag-question sa secretary niya, ba't patay na? Hindi ko na lang gawin na nun. So ako lang po inad kasi talagang no one can tell who talaga eh. Once
Yeah.
na nag-start yung cancer, talagang we need to accept. Siguro kailangan lang talaga ng tamang pagkakataon para masabi ng isang taong may cancer na ma-open niya yun.
Yeah. Okay.
Opo.
So acceptance talaga, reality, but always believe that all of us will go. Okay. Kahit na ako, I can go anytime, di ba? Okay. Kahit na I won't tell you that I will stay forever here with you, di ba? Ang sinasabi ko, I might go anytime, di ba? Okay. So everybody will have his own time, di ba? Okay. Hirap, no? Hirap tanggapin ko minsan, pero that's the truth, di ba? Okay. So how to live that life, kaya may intentional living plan that factor in all those realities, di ba? Okay. Any more comments? Okay, Maria, Justa. Yeah, okay, your mother. Okay.
Just to share, I do know a few atheists.
80. Okay. Yeah.
Yes. To them, an atheist doesn't mean they have no moral principles. So, no, they have moral principles. They know right from wrong. They
Yeah.
just don't believe in God.
Okay.
So since they don't believe in God, they don't believe in heaven, they don't believe in hell.
Okay.
So when, like one said, if I get cancer and it's terminal, I die, and
Okay.
that's the end.
Okay.
There's nothing that they will look forward to.
Okay.
So it's very pragmatic or fatalistic. They they if they, sabi nga niya, me, I'm ready to go because that's what life is. There is a
Mhm.
beginning, a middle, and an end.
Mhm.
To them, tapos na yon. They don't believe in an afterlife. So
Yeah.
to them, hoping that prayer will help, they don't have that. Yun lang
Okay.
ang kanilang they
So
they
they
don't
don't believe in afterlife. So, pero alam
they don't
nila,
believe in
but
afterlife.
they accept the fact that they will die one day. Tama?
Yes,
They will
yes,
die
oo,
one
oo.
day. So
Oo, they will.
when they get sick, of course they still hope that they will get well, no? With hope.
Yes,
They
oo,
still
pero
hope.
sabi nga, oo, they if they survive, they survive. If they
Okay.
don't, they don't.
They don't. Okay. So
Oo, wala nang,
acceptance pa rin
oo,
yun, no? Just a matter of
oo,
yung difference lang
oo.
between the God
I
and no
think
God.
sa
No?
kanila nga, I mean, for the one I really know, he, I think acceptance comes faster to them.
Okay.
They probably, sabi, I think they would accept a terminal diagnosis faster.
Okay.
Kasi wala na, they don't, I don't know, parang fatalistic, you know what I mean?
Bakit nga? Bakit faster sila? Hmm.
Faster nilang ma-accept.
And the only
Uh,
difference between the atheist and yung non-atheist na may, let's say, believing in the afterlife o ano, pero
mm-mm.
may common endpoint mamatay, di ba? Pareho sila, di ba?
Mm-mm. Mm-mm.
Yung isa, let's say Christian o ano, those who believe something, but they just look forward to the other, to the
To the
afterlife. Parang
afterlife. Oo.
preparation, no?
Mm-mm.
Yung sa atheist naman, okay, mamatay ako,
Tapos
patay.
na.
Tapos na, no?
Tapos na. Wala na.
Okay. So is it because they're not, wala nang silang they don't worry about the afterlife anymore?
Oo,
Ganon.
wala na. They don't. Oo.
Ganon. Kaya
They
parang,
don't believe in a reward or a punishment.
okay. So simple lang, simple sa kanila, simple.
Oo.
Oh. But this is on the assumption that meron silang parang may moral value sila, ganun, di ba?
Oo, meron naman ho. They have, I mean,
Oo.
like, society, living in society for 2,000 years. Siyempre, it's built
Yeah.
up there is an accepted course of action and an unacceptable course of action, di ba ho?
Yeah.
The good, the bad.
Yeah.
But it being dictated by spiritual being, hindi sila naniniwala doon.
Mhm. Yeah. So
Oh, it just, you don't harm anyone because it's not right. Not because it was deemed right or deemed wrong by a commandment. Ganon sa kanila ho eh. I mean, at least this atheist that I know.
Yeah. Yeah. Okay. So I was just
Uh,
thinking, baka simple lang. There's an end point
mhm.
and then acceptance pa rin, di ba? Acceptance.
Acceptance, oo, acceptance na tapos
Yung
na.
isa, merong afterlife preparation, no?
Sa
Preparation.
kanila wala.
Sa kanila wala.
Wala.
So, bottom line is acceptance, whatever it is, di ba?
Acceptance, oo,
Hindi nila
acceptance.
Okay. Kasi kahit na may afterlife, may acceptance pa rin sila. They should accept that they will die. They will die. Di ba? Ganon. Okay. So,
Kaya
kanya-kanya.
lang ho, syempre, oo. The thing kasi ho is, syempre, we believe, our belief is that yung salvation, di ba ho?
Oo.
we have been saved already. So when we yun yung ano natin. Sa kanila kahit wala. So parang in our mind, naku, this fellow will go to hell even if he led a good life. He's going to hell because he doesn't believe.
Yeah.
That's what is in our minds.
Okay.
Oo. Sa kanila walang ganun.
Wala na. So, mas I don't know. I don't know how to judge that. So, mas
Oo, kaya ano?
simple nga. Basta patay.
Patay na.
Basta as long as you did your part as a responsible citizen on earth, tapos na.
Yes, oo. I mean, they have moral. They're moral people. You know, they're
Yeah.
not serial killers or anything. They're moral. Then for me, nakatulong for mommy was right after the diagnosis, she had the last rites right away. Extreme, ano ba ang tawag? Anointing of the sick. That's what it's called now. Hindi na last rites.
Anointing of the sick.
That helped a great deal.
Okay. How did you tell your mom?
No, she knew.
She knew.
She knew. Oo. She knew. She knew. She knew even before I did that what she had was something else. Alam niya, she was not.
Rex, yung mami mo, alam niya?
Hindi po malinaw daw kung alam niya kasi hindi po namin sinasabi na ano na eh.
On my part naman as a doctor, kamisan, I have difficulty telling the patient mismo, point blank, no? Okay, that's why I usually go around the relatives muna, di ba? The relatives muna. And then asking their help on how to approach the issue, di ba? Kasi mahirap sabihin sa pasyente right away, wala nang pag-asa, wala nang ano, di ba? So, what do you think? Anong suggestion mo, Rex, saka Maria, ano, and the others? How should a doctor approach it? I mean, paano sasabihin sa mga pasyente?
I think the way you told me po, me and my sister-in-law, we were the ones who went to you. You told us from the beginning, okay, this is a very bad, it's one of the worst cases, as you said. And at this stage, sabi mo nga, there is no survival. But it doesn't mean again that there is no hope. You said that. So that I think is how it should be done.
Yeah, I was not the one talking to your mom, diba? You were.
No, she could not. She could not leave the house anymore by that time.
So kayo
you did that.
So kayo ang parang nag-communicate sa kanya in one way or another, di ba?
So I told her, sabi ko, I told her, okay, mom, because she knew naman ho eh. She told me, this is cancer. Sinabi niya.
Yeah. So may mga situations na medyo madali, alam na nila, di ba?
There's no denying it, sabi niya.
Denial.
I said, kaya sabi ko, sabi nga ni Dr. ROJoson, tama yung hinala mo. And then the first thing she said was, I'm not going to a hospital. And I said, that's what he said also. I'm not going for treatment. That's what he said also. So by that thing, I mean, she accepted it already. Di ba ho?
Yeah. Yeah, medyo madali no? Yung kay Rex baka medyo mahirap, di ba?
Oo, that's a different case. Kasi kay Mommy, it was terminal na when you
Yeah, on my part, kasi talagang hirap na hirap ako to tell somebody point blank.
Opo, talaga naman po.
Pag 100% sure ako, madali. Pero I'm not even 100% sure. Di ba? Baka 99, 98 lang. Gano'n, di ba? Okay, yan ang hirap, no? Tapos, that's why my approach is to talk to the relatives, no, muna. No. Okay. Any more comment? Last comment before we leave, before we adjourn?
Doc, another lang. Yung sa amin po kasi, siyempre pinag-usapan din namin ng family kung papaalam namin kay nanay na
Yeah.
wala na.
Ah,
Yung isa ko kasi, yung kapatid, yung ate ko, hindi siya nag-agree. Huwag na lang daw ipaalam kasi baka umiyak. Parang gano'n. Hindi
Aha.
daw masasa. Kaya, siyempre, may kinalaman pa rin talaga yung agreement ng family kung anong dapat gawin. Kaya hindi ko na rin po diniretso kay nanay. Pero I think naman, may idea si nanay. She can read between the lines naman po. At first pa lang, alam niya naman yung cancer is fatal. Ano naman si nanay, nagbabasa naman talaga siya. Kaya niya na maintindihan.
okay.
Kaya, tsaka si nanay kasi, ano siya, soft spoken siya. Hindi talaga siya yung masalita. Pero alam ko naiintindihan niya yung situation niya na anytime pwede siyang mawala. Hindi nga lang talaga namin na verbatim sinabi na wala na. Wala ka
Okay.
na. Wala ka.
Okay, so the approach is just indirect na lang, indirect way of hanggang mag-sink in sa kanya on her own, di ba?
Yes po.
Okay.
Actually po, Doc, nung nandun sa nakaratay sa hospital, nung medyo ilang oras na lang, minuto na lang, sinesenyasan niya na ako, hindi ko lang ganong na-gets. Kasi may mga procedures pang ginagawa yung nurses sa kanya. Parang sabi niya, gumanon na siya.
Pag na. Okay. Yeah. Okay. Very challenging yung mga ganun, management, no? Not only on my part, kayo rin as relatives, mahirap din, no? Okay. Okay. So, no more questions, comments? If there are no more questions, we'll call it the day for today for this particular pep talk. Okay, so next Saturday, we will not have a pep talk, but on Sunday, we will have the Cancer Crusaders Club virtual meet on Sunday. Diba? So wala yung Saturday, pero on that Sunday, December 3 na next week, di ba? Okay, Sunday, we will have the Cancer Crusaders Club na virtual meet. So attend ho kayo at kung meron kayong mga messages that you want to send me, okay, greetings, tinatapos ko yung proceedings, na. So who wants to send kahit na 1 minute, one-liner greetings to the Cancer Crusaders Club, padala na lang kagad sa akin o kay Beth, na. Okay. Okay. So parang 1 minute na greetings as well as konting inspirational, parang yung one-liner na inspirational talk, na gano'n, one-liner, 1 minute lang. So submit to me as early as possible, bukas kung pwede, tonight, tomorrow. Kasi I'll try to compile everything now. 1 week na lang di ba? Okay. Okay? Thank you.
Yes. Thank you, Doc.
Sige. Bye-bye.
Thank you, Doc. Bye.
Thank you, Doc.
Bye-bye.
Thank you, Doc.